Hello, hello, everyone. Welcome back to another episode. My guest today is Dr. Taylor DeGroot, a doctor of optometry with a passion for holistic medicine. Driven by her belief that the body is a dynamic, cohesive system, she's on a mission to help people improve their vision and overall health by getting to the root causes of eye issues. She's not your typical eye doctor, though. Taylor practices holistic eye care, understanding that our eyes are not isolated parts, but integral components of our whole well-being. In this episode, we discuss some of the most common eye-related problems, from glaucoma to cataracts and dry eyes, and we explore the often overlooked contributors to these issues. And let's not forget floaters, which so many of us experience and are told by our eye doctors that they're no big deal. That has certainly happened to me. Taylor will shed light on what causes these mysterious phenomena and what we can start doing about them. But that's not all. We'll also discuss an eye health topic that might surprise you: parasites in the eyes. You heard that right. Plus, you'll discover whether it's possible to improve your vision and what you can do to enhance it naturally. If you're a contact lens wearer, which I used to be, stay tuned as Taylor reveals potential issues with contact lenses, including concerns about PFAS and infections. We'll also uncover the intriguing connection between your posture and your vision, as well as the emotional aspects tied to eye conditions. In addition to that, if you're thinking about LASIK surgery or you've had LASIK like me, Taylor will share her insights into why she doesn't recommend it and offer guidance on post-surgery recovery. And finally, we'll touch on those common eye drops you might be using and how they impact your overall eye health. So, if you've ever wondered about the intricate relationship between holistic health and your eyes, this episode is a must listen. Get ready for a truly mind-blowing conversation with Dr. Taylor DeGroot. And if you absolutely love this episode, please share it with your people. Also, tag us on Instagram if you do. I'm at Nicole M. Jardim, and Taylor is at Optimizing Health. OPTIMEYEZING Health. Of course, if you're feeling extra generous, go and rate the podcast as well on Apple Podcasts and Spotify. I am always so grateful for your feedback and reviews. Thank you so much, and I hope you enjoy this episode. Hi, Taylor. Thank you so much for being here with me today.
Thank you so much for having me.
Yeah, I cannot wait for this conversation. I feel like, as I was saying to you before we started recording, that I have been looking for someone with your expertise to interview for such a long time. And when I discovered your work, I was pumped because you talk about all the things I've wanted to talk about as it relates to eye care and eye health for so long. So anyways, I would love for you to just tell us a little bit about how you even started this. Like, how did you
Mhm,
decide that you were going to take a holistic approach to being an eye doctor?
mhm. Yeah, so I sort of kind of got into the whole holistic health rabbit hole, I would say, as a senior year of college. And then I decided to go to optometry school. I didn't necessarily know that I wanted to like kind of make my own niche with holistic optometry before I kind of started. But kind of like as I was progressing through school and I was learning more about holistic health outside of school, I realized how much more we could really be doing for patients and how a lot of patients were really not getting the care that, you know, I knew I could provide them with from the conventional system. So after I graduated, I really had a lot of experiences in optometry school where I wanted to give people different, alternative ways of healing, and I just wasn't really able to do that when I was working in conventional practices. So I just decided to kind of go out on my own and just kind of work with people as more of a health coach and having that, background in working in conventional optometry definitely gives me a leg up in helping people that have eye problems as well, because I've seen kind of both sides of it.
Oh, yeah. No, I completely agree. I love this. And I do feel like your story is so similar to many practitioners I've had on this podcast, actually, because they were trained traditionally and then
Mhm.
realized this wasn't quite what they signed up for.
Mhm.
And so they then realized that they needed to take a bit of a different path.
Yeah.
So, with that said, can we talk a little bit about what holistic eye care actually is? Because obviously,
Mhm.
in my experience, and as you were just describing, uh, the idea that eyes are part of your whole body
for whatever
Mhm.
reason, just doesn't really make it into the equation when we're learning in, or at least in the traditional sense with regard to the
Mhm.
training, right?
Yeah, for sure. So, one of the things originally that didn't really sit right with me was that when someone's given a prescription, they're tested kind of under kind of unnatural conditions in the exam room. You're under artificial light, you're stressed, you might be like slouching or sitting in a weird position. It's actually better to do a refraction when you're standing up because that's more of an accurate assessment of your vision in real life. So
Whoa.
I realized a lot of these things were kind of not sitting right with me, and the fact that when you take someone's vision, you're testing them at 20 feet distance, which is optical infinity, but you're telling someone wear this prescription all the time. And then so for a lot of their day, let's say they're doing year work, they're doing computer work for most of their day, they're not looking at that 20 feet distance for most of the day. So they can be at like 20 times wearing glasses that are 20 times too strong for their activities. Let's say if they're doing, near work or reading, stuff like that. So that was one thing that I was kind of passionate about, kind of getting the word out about and telling people about that. Most people do need a reduced prescription, or you just need like a different prescription for different reading for different activities.
Okay.
So having like a prescription that's set for near work, that's very, very reduced, is super, super helpful for people. And it's also important for, getting someone's nervous system out of fight or flight, because when we wear glasses that are way too strong, it kind of locks the body into a stress state.
What? Seriously?
Yes.
Oh, tell
Yes.
me more. This is amazing.
So most people are, wearing glasses that are too strong for the set distance that they're working at. So what happens is when you're looking up close and you're wearing a minus prescription, which is most people are myopes, I would say.
Okay.
And they have minus lenses that they're wearing. And so what minus lenses do is they force the eyes to converge and they force your eyes to accommodate. So accommodation is actually um, something that the nervous system does, and that has a direct effect on the nervous system and keeping someone stuck in that fight or flight response. So that's why a lot of myopes, they tend to be, more stressed, they tend to be more of like type A personalities. um,
Yep.
and I think there's a lot that goes to say for, how a person becomes myopic. I think there's a lot of different factors, but I definitely think stress, and just like trauma in general is a big trigger for someone's progression into myopia, as well as the fact that they're put in these minus lenses and their eyes are being forced to accommodate, and that also affects the growth of the eye, and that kind of makes them progress a lot quicker than they would without being super over minus in glasses.
Wow. Okay. My mind is exploding right now because I mean, my dad died really suddenly when I was 11 and I needed glasses within a year of him passing
Mm,
away. And then I never wore the glasses because I didn't like how they looked on my face, you know.
yeah.
It's like 12-year-olds. Um, but I but I remember Dr. Christiane Northrup, I believe, in one of her books talked about puberty and girls. And it obviously it's a very stressful time. And there's a significant amount of girls who need glasses, who start to need glasses at that time. So I just think it's an
Interesting.
interesting correlation, what you're describing
Yeah.
about the nervous system piece.
Hmm.
And then I'm just curious about that side of things too. Like, is should people be paying attention to that? Like if they are starting to have vision problems, like is there potentially like nervous system issues, dysregulation, extreme stress in their lives that they should be looking at as being a potential contributing factor?
Yeah, I've definitely seen that with people. Like similar stories to you have, like, oh, my parents are getting divorced and then I needed glasses, things like that. I do hear a lot. But I would say a lot of stories I've heard about people, reversing their myopia and like decreasing it by a lot. Like I have someone I spoke to, who went from like a minus 10.5 to a minus 2.5 that she's at now. And she said a big part of her journey was remineralizing, so learning how to properly mineralize. And when you do that, you actually also get rid of heavy metals as well. So I think that's a big part, is the nutrient portion of it. And then another part, I guess the nutrient portion kind of goes along with oxidative stress, because we do know there's also an oxidative stress component in myopia.
Right.
And then the nervous system part also plays a role, because that controls how tight the muscles are that control the eyes. And then, so one of the other things she did, I guess that kind of worked on the nervous system portion, was cranial sacral and like upper cervical chiropractor. So those two modalities also really helped her. I guess what it did was it kind of, when you're addressing like the cranial torsion, you can
Yeah.
not only improve astigmatism, but you can actually take the stress off those eye muscles and allow for the eyes to kind of move more freely, and allows everything to work better. So those are
This
two
is so
tips I
incredible.
have.
Yeah, no, that's great. Okay, so you just talked about reversing it's myopia, right? Not
Mhm.
myopia, myopia. Okay.
Myopia, yeah.
Yeah, right. Okay, just checking. So you just talked about reversing them, that this condition. That, I mean, I think that that's unheard of for most people. I've heard it, sort of on the fringe of my wellness world, and of people reversing this, or at least reducing their prescription. So you're
Right.
basically saying that with these kinds of modalities, and obviously, yeah, the nutrition piece, imagine, is
Mhm.
huge, but that is potentially, it's possible to lower your prescription, possibly, or even reverse it completely.
Yeah, and also just there's another component I would say that's pretty important, is the blood sugar portion. We know with like diabetics, let's say someone's diabetic, their prescriptions can change all over the place. So
Whoa.
sometimes a diabetic will have uncontrolled, blood sugar issues, and this actually kind of affects the lens and how much like water retention there is in the eye. And so when the lens swells due to changes in blood sugar, this causes like drastic changes in their prescription. So I would say, blood sugar is also kind of intertwined with mitochondrial function. So the more, the poorer the mitochondrial function, the worse, insulin sensitivity you're going to have. And so um, all of those things kind of play a role in it. So that's one of the cool things I think you can actually see, though. You can actually see how hormones affect it as well, because when women get pregnant, their prescription often changes as well. So there's
Oh.
definitely so many different, working parts and components to it. But I would say the nervous system is definitely a really, really big component for a lot of people.
Yeah. I mean, what you said about diabetics and blood sugar makes so much sense when you think about uncontrolled blood sugar, and how inflammatory it is to the body,
Mhm.
and how detrimental it is to every cell in our body. I would think with delicate eye tissue, it makes so much sense that it could be so problematic. But the fact that diabetics, or anyone with dysregulated blood sugar, or severely dysregulated blood sugar, could have changes in their
Yeah.
prescription, I had no idea. I didn't know
Yeah.
about
So
pregnancy either.
So oftentimes, like a diabetic will, get a prescription, they'll come back, 2, 3 weeks later and be like, oh, this prescription's wrong. But meanwhile, you kind of have to like go easy with it and kind of just be like, oh, have you like checked your blood sugar lately? Like, how is it? Because oftentimes it is related to that. And it can be like a drastic change. Usually it is a myopic shift, but it can also be, in the other direction. But I would say more often than not is a myopic shift because of that lens swelling that
Right.
occurs.
Right. Oh, yeah. No, this is so fascinating. And so one of the other things, I mean, I will talk more about this, but one of the other things I wanted to talk about was conditions that you see most often, I imagine are really common in the population, things like cataracts and dry eyes, or chronic dry eye, I believe they call it, and then things like glaucoma. Um, are these the most common issues you see? And, can you talk about their sort of underlying causes? Because again, I feel like the message is, well, this has just happened to your eye, and there's not a whole
Mhm.
lot you can do about
Yeah,
it
there's nothing
besides
you
like
did.
surgery or.
They're like, there's something you did that, with your diet or anything. They kind of don't really go into that.
Yeah.
I think the problem with especially how we treat dry eye is we treat it as like, oh, the oil in the glands is just getting clogged, so we just have to reverse that. But meanwhile, what they don't kind of realize is that the tear duct is actually a target of thyroid hormone. So chronically reduced thyroid hormones are actually found to decrease tear secretions and lead to dry eyes. So there's so many different components with, the overall metabolism. And I would say dry eye is really an energy deficiency in the body. So when you look at it from that lens, there's so many, other things you can do to kind of improve this condition. But I would say most of the people that are suffering from dry eye do have some maybe it's not like full-fledged hypothyroidism, but it could also be like a subclinical hypothyroidism where it's not yet showing up on blood work, but at the cellular level, the body still isn't getting those hormones or able to absorb those hormones, right? So there's other component I would say is the blue light. That's a big one. So the blue light is also causing oxidative stress and weakening people's mitochondria. And then on top of that, we're doing a lot of near work, so we're not blinking as much. And when we blink, we actually spread the tears onto the eye. And so what happens when we're staring at our screens or when we're stressed is we kind of stare and we keep our eyes open, and then the tears evaporate off of our eyes. And again, that's kind of like this vicious cycle that leads to the dryness. But yeah, with my dry eye patients, I really work a lot on, remineralizing, because obviously that has a direct effect on how our mitochondria function and how we can actually utilize energy and utilize our vitamins. So I would say, starting at the mineral piece is pretty important, and then also just correcting, thyroid imbalances that can really be super helpful. But then we also kind of work on, topical therapies as well, while we're kind of working on the root cause.
Right. Okay. We're going to get into a whole conversation about what one can do, because
Yeah.
I really love this, and it really speaks to everything I've thought about over the last literally 2 decades or 3 decades since I started having eye problems. I actually did have LASIK done, but we'll get there.
Okay.
I'm a little scared about what you're going to tell me.
Yeah.
But so do you fundamentally believe, I mean, obviously I know that there are gut issues, and I feel like the gut is sort of the root of all of our problems ultimately. But when you're talking about the mineral imbalances and you're talking about remineralizing and all that, like, I understand what you're saying. But you're talking about from like the perspective of there's dietary changes, possibly supplementation, just changing things up that way, I imagine.
Yeah, so one of the ways I work on the mineral piece is, I mean, personally, I do bioresonance testing, but I also partner up with someone who specializes in hair tissue mineral analysis. And so the
Right.
HTMA is a really good tool for figuring out, exactly the ratios between the different minerals. My testing, I can see like which ones are most out of balance, and it lines up with the HTMA. And then from my testing, I can also kind of confirm with the HTMA and actually test that person's body specifically to see if they resonate with certain mineral balancing supplements. So the mineral balancing protocol, it's the lab that I use, it's ARL. So we kind of base recommendations off that and the bioresonance testing to see what is kind of going to work for a person's body.
Nice. Oh, I love this. We'll keep getting into it, but I did want to just get some clarity on what you're doing, and so that's awesome. And a few other eye things that I feel come up a lot are floaters, and I'm curious about those, like what causes them. And because every time I've ever had them in my life, and I mentioned it to the eye doctor, they're like, oh yeah, no, they just brush it off. Like I've never,
Yeah.
I don't think I've ever had an eye doctor say like, let's explore that, or here's why that might be happening. So I would love for you to impart your
Yeah.
wisdom on us, because I know lots of people have this question.
Yeah, so floaters is definitely a sign that something is off in the body. I mean, LASIK is definitely a risk factor for floaters. I would say most people that have had LASIK do experience floaters, just because that surgery can kind of disrupt the vitreous a little bit. But what it is there's basically something called the vitreous, which is a jelly-like substance in the back of the eye. It actually makes up about 80% of the eye, so it is a sizable portion of the eye. And this is made up of like collagen, hyaluronic acid, GAGs, and so all this kind of like structured water back there. And what happens when we see floaters is that collagen is kind of degenerating and the structured water is kind of liquefying. So instead of being more of a jelly substance, it's becoming more liquid, and it's kind of just degenerating. And that's why we see the floaters. So also what's happening is there's a breakdown of the collagen as well. And also kind of what happens when the vitreous gets more liquid is it loses its ability to consume oxygen, which kind of results in more oxidative stress. So one of the ways that we can fix this is optimal thyroid levels. And then the other thing I would say is, correcting, cellular dehydration. So remineralizing goes along with that. And also just getting, full spectrum sunlight. So the blue light is definitely not helping with structuring this substance.
Yeah.
And so we actually see that the visible light spectrum, infrared light, and ultraviolet light all work together to create structured water. So getting, full spectrum sunlight throughout the day and, optimizing your circadian rhythm can really help with floaters. And then the other thing I see with people that have floaters is sometimes like chronic infections. So like Lyme, different infections that kind of arose because the immune system was suppressed. So some infections were able to kind of take hold, and those are causing degeneration of the collagen at a faster rate than should be occurring.
Whoa. Yeah. This is such good information. And again, I think so helpful for anyone who's listening who has struggled with this and isn't getting any answers. So I feel like that's so helpful. It started to make me think about when you were talking about pregnancy, I was thinking about the birth control pill because I felt like my eyesight got worse while I was on the pill. I definitely noticed an uptick in my prescription at that point in my life. And then things stabilized for a number of years after I came off of it. So I just think it's so interesting for us to be thinking about, those kinds of things.
And I mean, we do know the effects that, the birth control pill has specifically on the gut. And so that could kind of lead to dysbiosis and infections, and all of that can kind of influence the eyes and just, increasing the oxidative stress. Anything that's going to impact oxidative stress is going to have a negative impact on the eyes. So I could definitely see how that affected it. But yeah, I think there's definitely a lot to consider. And with floaters, one of the things I tell people that I think definitely helps reverse them is like proteolytic enzymes. So like systemic enzyme therapy, that can be a way to kind of break down any, excess kind of like undigested proteins and things like that that are kind of floating around. And it also reduces the inflammatory load. So that's one thing to do. And also just like supporting collagen health. So getting collagen, gelatin, whole food vitamin C, minerals. One supplement to help with collagen is MSM. So you can do MSM drops or MSM powders. That can kind of help to strengthen the collagen in the body.
Okay, don't give all your secrets away. They're really good. I love the proteolytic enzymes. In fact, I love the ones from MitoLife. In fact,
like
weren't you
too.
on his podcast? I think that's how I found out about you.
Yes,
you were. Okay, yes, I know, and it was amazing.
That was actually one of the first podcasts I went on. I was so nervous for it.
You were? I can imagine.
Yeah.
I was
a big
like, deal.
I was like, oh my God. Like I was so nervous, but now I'm kind of like got into the groove with podcasting, and I'm like fine with it now. But
you're a pro.
I was so nervous for that.
Well, that's a big one for sure. And I mean, Matt is so knowledgeable, and I love everything he puts out, and his supplements are amazing. Those proteolytic enzymes are like hands down the best
those
I've
are
ever
great.
used. Yeah.
Yeah, those are amazing.
Yeah, truly. Oh, sorry, we were going to say something else about the floaters.
No, I think it was pretty much done.
Okay. Talk to me about like dry itchy eyes, because that I think is a big one. And you had talked about parasites as well, and I don't know if there's a connection there or not, but maybe they're two separate things. But maybe we start with the dry itchy eyes, because I feel like that's a whole thing. And I've heard in various places, like maybe you have a fungal infection or some kind of infection in your eye or on your eyelid or something like that. How does one even test for something like that? Like for infections? I mean, do you even, because I feel like you could go to the eye doctor and you have dry, itchy eyes and they're like, oh yeah, just take some eye drops type of thing. And that's the end. But how do you advocate for something like that if you suspect you have that issue?
So, with dry and itchy eyes, specifically red eyes, I often see histamine issues, but histamine issues kind of goes along with gut issues. So
Totally.
oftentimes, like chronic gut infections can cause the histamine issues. So I would say, I mean, there's definitely things you can do to kind of reduce histamine, take antihistamines and all those things, but really addressing the root cause would be more of like a better fix for that. So I would say definitely looking to the gut to see if there's any infections there. Some tests for that, I would say a GI map is good, or bioresonance testing, the testing that I do. I do love that also for picking up different GI infections. Both of those can be useful. And yeah, I would say definitely investigate further if it's like a really big issue for you, especially with like rosacea and things like that. There's often like some sort of SIBO going on, candida overgrowth, which I see a lot. So all of those things definitely contribute.
Mm.
With the parasites, I would say like seeing an actual parasite like moving around in the eye is not very common, but seeing something like Demodex mites, which those are like on the lids and you can see those with a slit lamp, it's kind of like these mites are kind of part of the normal flora, but they tend to overgrow in people that have dysbiosis on the skin and also in the gut. So that's one thing that can cause like dryness, itchiness, kind of eczema, flaky skin as well. Um, I do have, I did see one client who was having really bad eczema and redness around the eyes, and he did show up as having Demodex mites. So that's one big cause that I see.
That's it. That's what I've
Um,
read about, the mites. Yeah, and I couldn't remember what it
Demodex.
was, but now you've said it. So that's the one. And so if you have these, like how do you go to your doctor and say like I think I might have Demodex mites? I
Mhm.
mean, like what how does that work?
So the doctor does look for these, and they would be able to actually see them on the lid with the microscope.
Okay.
So that's something, yeah, you could for sure ask them, like, did you see any Demodex? They would probably be like, how do you know what that is? But they would definitely be able to see that and tell you if they do see that. They kind of form these little like collarettes in the lashes, and so they can also see if you have those, and that's another sign that you have and kind of an overgrowth of these. For those, I really like royal jelly. That can be really good, and also okra. And you can even make like a spray with okra, and that's been shown to be really effective for kind of restoring balance back.
Incredible.
Sometimes they say to use like tea tree oil and stuff like that. I think it's a little bit too harsh and kind of disrupt the microbiome, and then you're kind of just like on a killing spree all the time. So I
Yes.
kind of go for more like gentle approaches, like restoring balance rather
Okay.
than just like killing.
Yeah.
But yeah, I would say that one is super common, especially in the elderly. And it's kind of like, I would say like how candida is like rampant and so common nowadays. It's kind of like that, but for the lids and lashes. And the other one that's super common with parasites is toxoplasmosis. That one you do see a lot in the eye. It's not like super common, but most people have seen, a good handful of these in their career, and it is, relatively common. This is spread by like cat feces, undercooked meat. You can even have, the scars from this in the eye and never have had any symptoms or know that you had the infection. They can also be Toxo can also be passed down in utero, so you can even see this in kids and babies, and they never had any symptoms. They just have a scar in the eye, and it's a very kind of distinct looking scar, and you'll know that there was a toxoplasmosis infection.
Oh, so like if you were to go to your doctor, they would be able to tell you that? Your
Yes,
eye doctor?
yes.
Oh,
Just by looking
fascinating.
into the back of the eye, you have to look at the retina. So they can take a picture of the retina with the retinal camera, or sometimes they use that lens to look in the back.
Right.
And so those are the kind of the two ways that they look at the retina and check the health of that. But it's pretty cool because the retina is actually the only part of the body where you can see the blood vessels without cutting the body open. So it's like the only organ that we can really, really see into and get a close look at. And that's one of the reasons why it's the eye is actually being used as a target for finding like early detection for things like Alzheimer's.
That is so fascinating. That's what I was just thinking about actually with something like diabetes or insulin resistance. Are there telltale signs in there too of
Oh
those?
yeah, for
Yeah.
sure. So diabetics usually depending on how long you're diabetic for, once you're diabetic for like 20, 30 years, you by that point usually are seeing some signs of it in the retina. I would say if it's uncontrolled, it's very likely that you're going to have leakage of the blood vessels. What happens with diabetics is the blood vessels get kind of weak and leaky. So you'll see little hemorrhages in the back of the eye sometimes. You'll see, sometimes blood in the back of the eye, and then you also see exudates in the back of the eye. And so that's kind of like just leakage of things that shouldn't be there. And once it's really uncontrolled, that's when you're kind of at risk for losing vision. But if it's controlled, most people don't really you shouldn't see issues, and it is reversible to an extent, but once it starts getting like there's blood in the back and there's a lot of leakage, that's when it kind of becomes hard to fix, because the damage is kind of getting worse and you're damaging those like really tiny cells. And so to an extent you can reverse it, but once it starts getting really bad, it's definitely harder to reverse.
Man, when I think about how many people should know this, and if they did know this, they might think differently about the choices that they make with regard
For
to
sure.
their
Yeah.
diet and lifestyle and everything, because nobody knows. Nobody has any idea.
Mhm. High blood pressure shows up too in the eye. So you'll see changes to the vasculature and the blood vessels in the eye, and that's a sign of high blood pressure. And you can also see kind of the same things with the diabetics, where you'll see like little spots of blood in the eye and leakage and things like that. So
Ouch.
there's all sorts of things you can see.
It's incredible. So you said, is there more research now of looking into using the eyes for, as a window into our overall health?
Yeah, so definitely with Alzheimer's, they're coming out with like all sorts of different technological advances using even AI. I think they're using now to kind of do early detection for Alzheimer's. Glaucoma is actually like the Alzheimer's of the eye. So a lot of this similar pathology that you see with Alzheimer's, you see in glaucoma. So I guess it really depends on, where a person's weak spots are, where they'll see more damage. But yeah, I do see I know like they call Alzheimer's like type 4 diabetes or type 3
Like
diabetes
type 3,
now. So
yes. Yeah.
so I think it's similar idea with the eye, where mitochondrial dysfunction causes issues with glucose transport and glucose regulation in the eye, and we do kind of see a lot of those same issues that we see with Alzheimer's with glaucoma. So anything that's good for the brain is going to be good for the eyes, because the eyes are brain tissue.
Oh,
Embryologically,
right.
they
Oh, yeah.
stem from the brain. So
Oh, look at that. Yes, exactly. Of course. That's so cool. Of course they do.
yeah.
And yeah, no, it makes so much sense. And I feel like you're just connecting so many dots, at least for me, and I'm hoping for everyone who's listening. So thank you for this. I wanted to switch gears a little bit and talk about contact lenses. Oh my God, they were the bane of my existence. So of course I got the glasses, didn't want to wear the glasses, finally had to wear the glasses because I couldn't see like 13, 14. And then finally got contact lenses at 16. And that was a very long time ago because I'm old. And I remember I think that the soft lenses were kind of a newish thing, and they were more of the disposable types. So I was really excited because it's like, okay, finally I don't have to wear glasses and be this dorky teenager. And so, I got these things, and I was clearly not great with my contact lens hygiene at all. It was bad.
Mm,
And I mean, it wasn't bad, but I feel like I could have been better.
yeah.
So I found myself getting eye infections and,
Mm,
always sort of having these eye related issues. Then I started having dry eyes, but I didn't really want to wear the glasses anymore, the saga. So anyways, I'm curious what your thoughts are. I don't really know much because I told you I had LASIK. So I feel like I haven't had to think about any of this now for 12, 13 years. So I'm curious, like, what your thoughts are on contact lenses and what are the
yeah.
related issues that someone should be
Yeah.
thinking about with them?
Mhm. I'm definitely partial to glasses over contacts.
I bet you are.
Couple of reasons for that. One is that, I mean, glasses and contacts both block UV light,
Right.
but contacts, it's hard to find. I think there's like one brand or a couple brands I know of that don't block UV light, and one of them is called Daily Total One. So that's a possible choice. But then the other problem with contacts is that recently there was this whole I kind of caused a commotion. There was this study that was put out, I think it was like Mama something, Mama Vision, I don't know, I forgot the name of the article, but they basically tested contacts for PFAs, and PFAs are just like toxins that your body can't get rid of naturally. And so the safe threshold was 0.004 parts per trillion for drinking water, and they found the contacts exceeded 100 ppm, which is like 50,000 times higher than the safe level for drinking water.
So the actual the material of the lens,
the
is what you're
material
saying.
of the lens,
Yeah.
they're saying, is made with these PFAs. So it's not known how much our bodies will absorb, but there is kind of a route for absorption right here. There's like a little bump here, you can feel it, and that's called the puncta, and the puncta leads to the nasal lacrimal system, and that can get into the bloodstream. So like any drop that you're putting on the eye, up to like probably up to 80% can be absorbed systemically through this route. So when you think about that, there's probably some, extent of these chemicals that are being absorbed. So it's hard to say exactly how much because they haven't studied it. But given this kind of news, personally, I would stay away from contacts or just wear them like very sparingly for maybe like certain events.
Right.
But yeah, it's definitely concerning since the PFAs are also very mobile. And also you don't know really how those chemicals are even going to react when like they're exposed to sunlight. Like they might turn into even more mobile, more reactive compounds. So it's definitely concerning and definitely a reason to kind of limit contacts or stay away from them. There is like some brands that are coming out now that are claiming that they don't have PFAs. I don't have any way to like verify it, but there are some companies. I think one is called VSCO Vision. They're based in Taiwan. They're saying that they don't have PFAs, but again, it's still kind of it's definitely a gray area. It's kind of iffy, but
yeah,
I would say definitely glasses over contacts. The other benefit to glasses is that you can take them off. So let's say you're outside and you want to get the benefits of full spectrum light, you can take them off. Or even if you're doing near work and you have like slight amount of myopia and you don't really need your glasses for near work. If you're wearing contacts, you can't just like easily take them off. And
that's a great point.
So
yeah,
that's the other benefit to glasses.
That's super helpful, very informative. And so with regard to the just contact lenses constantly putting something in and out of your eye, is that problematic too, fundamentally from an infection bacteria perspective?
Yeah, so they have done studies that show contacts actually negatively impact the ocular microbiome. So again, you're negatively impacting the microbiome, so that makes you not only more susceptible to infections, but you're also kind of changing the different microbes that are on the eye, and those microbes are your protection, right? So that is definitely increasing the risk for infection. And obviously it's super important if you are wearing contacts to have good hygiene. Obviously dailies are better than monthlies, and just make sure they're being cleaned properly and you're not using like a toxic solution, because some of the solutions are better than others. So I would say, yeah, definitely if you are a contact lens wearer, those are things to consider.
Yeah, so helpful. The ocular microbiome, that's a good one. Again, we don't talk too much about the eyes microbiome. So I mean, obviously everything you're talking about, it can impact it, whether positive or negative. Are there any other things that impact the ocular microbiome that you feel people should know about? Like just like using eye drops, like I feel like there are a lot of people who use a lot of eye drops. I mean, is that a problem?
There are certain eye drops a lot of people use. So a lot of like the conventional dry eye drops are made from like petroleum based ingredients. So those don't tend to be the healthiest for the eyes. So I definitely recommend more like the homeopathic eye drop approach, or like just a regular preservative free artificial tear. And then also the preservatives also definitely have an effect on the microbiome, and also they are toxic to the cornea. So I would say that is definitely something to consider with a lot of these eye drops, is the preservatives that they use. It's better if you get the ones that are in the individual vials. But again, the individual vials are plastic, so it's kind of a trade-off there. But I would say also, steroid eye drops are pretty common. If there's like an eye inflammation, they often give steroid eye drops. And those do, I mean, a lot of times they don't tell you this, but those do increase risk of cataracts and glaucoma. So I would kind of use those sparingly, depending on, what's going on. Sometimes you don't need them, sometimes you do. It really depends on the condition. Antibiotic eye drops, those are used a lot. And then the other ones are like the get the red out drops. So like
Yes.
Lumify, Visine, those I don't recommend because they often have a rebound effect where what happens is they constrict the blood vessels, but then once the drug wears off, the blood vessels dilate more than ever just to kind
Oh.
of restore blood flow back. And so when that happens, you kind of have a rebound effect where you get more redness from using those drops. So those I certainly don't recommend those. And then the Lumify drops, they are a little bit better than the Visine and the Clear Eyes. But again, I still don't recommend those. They do also contain the toxic preservative BAK. So
Oh.
not the best to use for the eyes, but yeah, those are some common ones that people do tend to rely on sometimes.
Yeah, again, information that I'm pretty sure nobody had before this. So it's very helpful. Um,
Yeah.
what about posture? So you kind of briefly touched on this, and I know you've talked about this on your Instagram. Everyone, by the way, you have to check out Taylor's Instagram. It is so enlightening and so full of information.
Thank you.
So the connection between our posture and our vision, like what is that? I don't know that I've
Yeah.
ever even really heard that.
So astigmatism is actually very much associated with a twist in the posture and also a twist in the cranium. So if the sphenoid, which is, one of the bones inside there, if that's kind of out of balance, that's going to cause torsion and tension on the eyes. So I would say definitely, astigmatism is very, very strongly related to posture. And so that's an interesting component. So if you're able to kind of fix your postural imbalances, the idea there is that the eyes will kind of self-correct because the eyes are kind of changing the angle that they need the correction based on like different postural imbalances. So like if one shoulder is higher than the other, if you have like TMJ, things like that, where the jaw is going to one side, that often impacts the eyes as well, because that will impact things like a head tilt. And then so the eyes kind of just follow what the body does and vice versa, where the body follows where the eyes are. So those two things are so interconnected. So if you're able to fix the posture, you're able to fix, and if you're able to fix the twist in the cranium, oftentimes that reflects back into the eyes and also into the body posture.
Right. I mean, it makes so much sense. I definitely have a head tilt. I definitely do that. I know that for sure. So, and then I'm thinking of like having a traumatic birth and whether you're born like via vacuum or forceps. I mean, like I was. And
Yeah.
so you did mention craniosacral as being super helpful for,
Yes, for
that
astigmatism.
therapy.
Yeah.
Yeah. Okay.
Mhm.
So interesting. And then obviously I said I had LASIK. So I'm curious about your thoughts on LASIK because
Yeah.
a lot of people have had it done. I don't know what's shifted in the last 13 years since I've had it done. Maybe it's better. I don't know, but I am curious about that.
Mhm. So LASIK is kind of like getting a prescription tattooed onto the eye.
Oh, shoot.
So the problem with it is
Thanks.
that sometimes you do need, different glasses or contacts on top of it to allow the body posture to function better. So that's something you can have assessed. I have a friend Alina who does PRI, and I've seen her before. So she does kind of test the body to see if the prescription is working for the body and to see if it's locking the body up, if it's making you use more one side of your body more than the other. So ideally, you want both sides of the body to be working together equally. So again, if you're getting LASIK and you're getting that prescription tattooed on, that's going to have downstream effects. And she often says that LASIK patients are her hardest patients to fix, posture wise, because they're so like locked into that one prescription, and that has downstream effects on the body. So definitely work on getting the right prescription to kind of balance out being able to use both sides of the body together and more fluidly, and rather than like the prescription currently might be locking up the body. So that's definitely something to consider with LASIK. And so, yeah, the PRI practitioner will kind of allow for proper lateralization and proper side to side movement. And so that's why they check the prescription, because if the prescription isn't right, it can cause the body to lock up.
So when you say the prescription, you're talking about what you got when you had your LASIK surgery
Yes.
done?
Yes.
Oh, I didn't
So
realize it was a
basically,
prescription. I just thought it was a surgery to
yeah.
correct an imbalance, and that was the end. Okay, so
So
I'm
what they
wrong.
do is they actually change the cornea so that
Okay.
light hits it. They take off a certain amount so that light will hit it. So it's basically like they're making it so that you're back down to, seeing 20/20, but they're doing that by actually changing the shape of the eye. So they're
Oh,
basically like giving you the prescription by doing that
okay.
procedure.
I see. Okay. Oh, well, it's too late for me. But so what is a PRI practitioner? You mentioned
Mhm.
that. Like, what is
So
that?
PRI stands for Postural Restoration Institute, and it's basically a practitioner. They give you different like corrective exercises to fix your posture, and then they also do some manual therapy
Okay.
to kind of get the body back into balance. And they just assess your gait, they assess your breathing. So they're kind of working on all those things together. And then also a big part of fixing the posture is getting the right prescription that allows body freedom. So they
Right.
also should kind of assess that. And then they also have like specific dentists that they work with. So they do also work a lot with people's bites and fixing that as well.
That's what I was going to ask you actually about things like tongue ties and,
Mhm.
and like issues with teeth development and teeth coming in and jaw size and all of that, because obviously that's majorly on the rise. I know that's a
Yeah,
huge issue. I actually had a tongue tie surgery last year, which is no fun as an adult, I'll tell you that. But that I feel like has been, played a role as well in like all of my myriad health problems over the years. So is that like a part of it too, you feel like?
for sure. I think that the tongue tie thing can definitely contribute to astigmatism,
Oh, wow.
because, that's going to put more tension in the shoulders, the neck, and all of that kind of connects to the eye muscles as well. So something like a tongue tie can definitely affect tension just in the eyes and the cranium. So definitely, working on things like that can be super helpful. But again, I know there's a lot of like therapy you have to do before you get one of those done. So it's a lot of work, and
It is.
it's definitely not something to like jump into, and especially as an adult. I think with kids you can like do them right away, but as an adult, some people are also from a PRI perspective, what I've learned is some people are also using the tongue tie for stability. And so sometimes when you take that away, it can kind of really throw the body off and cause issues. So you have to be properly prepared and doing body work and, the exercises before you embark on something like that.
Absolutely. I know. And if anyone is listening and interested, I have multiple episodes actually on my experience. And exactly right. I did multiple months of all kinds of work. And of course, myofunctional therapy, as well as like working with an osteopath. So, yeah, tons of stuff. And I
Yeah,
agree. You really have to be
yeah,
prepared. You just can't jump into it. And
yeah.
even with kids, I feel like you should definitely be preparing them
Did
too.
you? Oh, I was gonna ask if you saw a change in your eyes, but you had LASIK.
I had LASIK. I know, and I'm so bummed because
I
I
was
would
gonna
have loved to have seen whether
to
that would have
see.
shifted. I don't know. So with with LASIK, like I know that it can degenerate, right? Like I could start to lose my vision again. Is that kind of what happens sometimes?
It's definitely like putting you at increased risk for things like floaters, and increased risk for something called a PVD, which is a posterior vitreous detachment.
Ah,
And so the vitreous, which is the jelly-like substance, it has all these connections in the eye. And what happens as we age and as the vitreous degenerates is that can kind of pull off the retina, because one of the attachments is actually onto the retina. So if this happens too abruptly or too hard, it can actually cause a retinal detachment. So you really want to, take care of the vitreous and support that as well as you can, so that you don't experience. I mean, most people, the chances of having a PVD is like 50% when you're 50, 60% when you're 60, 70% when you're 70. So most people will eventually get one, but you want it to happen gradually and not like abruptly.
right. Yeah.
If there's a big change that causes some abrupt change in the eye, it can lead to complications like that. So I would say definitely you're at risk of having a PVD earlier, And hopefully that you can slow that down and have that happen as gradually and slowly as possible. But yeah, that's definitely a risk factor. And then you're also at a risk for earlier cataracts as well, because it's disrupting the vitreous jelly in the back of the eye, which is 80% of the eye. So I would say definitely, keep on your eye health and keep on your systemic health, and hopefully you won't run into any issues later on. But just know that there are like increased risks associated with that. Yeah.
Thanks, Taylor. Thanks so much. Just kidding. No, that's really good to know, though. I'm all over it. I'm going to be all over this. And so, is there anything else? I mean, I feel like we touched on so many different things. You were an incredible wealth of knowledge. I'm just curious if you have any thoughts. You just mentioned like keep on top of your eye health. Like, what do you suggest to everyday people? Like, what should we be doing?
Yeah. So I do work with people that have LASIK, but I would say one thing that's super important, especially if you had LASIK, is just supporting lymphatic drainage in the body and in the eyes. So cranial sacral will really help. Just moving your body, exercising, all of that supports lymph drainage. Castor oil packs, supporting your liver, supporting your gallbladder. Those can be really helpful. And then for people that already have, damage and risk factors, you can do things like microcurrent therapy, laser therapy. There are different, delta laser therapy is a really good way to kind of stimulate new stem cells, improve lymphatic drainage, and just stimulate overall healing in the eye. So yeah, there's lots of things you can do to kind of help preserve your vision, and like other things I talked about earlier in the episode, just like supporting the mitochondria. There's actually specialized mitochondria in the lens of the eye. So just supporting that, getting natural light, red light therapy, all of those things can be super helpful. And then for my clients that do bioresonance with me, we're able to pinpoint what specific nutrient deficiencies, any toxins that are affecting the eye, and then we can also see specific remedies that will work best for them. So I do like to give like a more bio-individual approach, but for people that are looking to kind of just go at it by themselves, there's tons of different things you can try. I also really like taurine eye drops and SKQ1 eye drops. So SKQ1 is an antioxidant eye drop. Taurine eye drops are really, good for, obviously taurine is super supportive for the liver, but it helps with lymphatic drainage and all of those things.
Taurine is amazing stuff. And I did not know that you could get it as an eye drop. It's shocking. What was the other one? SK what?
It's called SKQ1. It's an antioxidant eye drop.
Okay. Well, I want everyone to come and work with you. You're incredible. Can you just share where they can find you on Instagram, your website, all that kind of stuff, and how they could work with you if they wanted to?
So you can find me on Instagram. It's at Optimizing Health. And then my website is airenergetics.com. That's my company, which I do bioresonance testing under. And we do have multiple practitioners too that just use the testing and work with people on optimizing their overall health.
Amazing. Thank you so much, Taylor. This was so good. I literally have learned so much in the last 45 minutes. Thank you again.
Yeah, thank you so much for having me. This was a lot of fun.
Thank you.
That's a wrap. Be sure to click that subscribe button to join me for more Girl Talk Gone Menstrual in upcoming episodes. But in the meantime, check out my latest Period Party episode. And if you're looking for a deeper dive into your hormones, go ahead and take my period quiz at NicoleJardim.com/quiz.